How's it going, everybody? This is Tyler Garton. This is my presentation over schizophrenia on the movie A Beautiful Mind. Explanation of schizophrenia. So, schizophrenia is defined by many different types of symptoms, which include delusions, hallucinations, or disorganized speech. Disorganized speech is incoherent, illogical, or difficult to follow when the person is speaking to you. Schizophrenia is a psychotic disorder. In short, means a disconnection to reality. Some causes of schizophrenia, um, they found that stress, prenatal nutritional problems, and psychoactive drug use during adolescence can contribute to the cause. Changes in the brain indicate it is, in fact, a brain disease. A little bit of the explanation continued. Treatments for people who suffer with schizophrenia have the option of many different treatment types, ranging from medication, therapy, and some facilities offer evidence-based treatments that are tailored to each patient's unique needs. So each person who has schizophrenia kind of they might be on a different spectrum level of where they're at. So those facilities can offer different treatment packages to meet the different needs of each individual. Medicine is the main schizophrenia treatment. Antipsychotic medicines are the most prescribed drugs. They're thought to control symptoms mainly by affecting brain receptors for different neurotransmitters or chemical messengers. Most antipsychotic medications um, on act on dopamine and serotonin receptors also. A couple signs and symptoms um, for people who may suffer from this disease. Signs of schizophrenia include hallucinations, being a big one, hearing and seeing things that aren't there. Delusions, when you hold on to false beliefs, even with proof that they're false or illogical. And then, like I said, with the disorganized speech, when your thoughts or words are disorganized or especially strange, um, that could be a key indicator, that you might be going through the signs and symptoms of schizophrenia. Going on over to the symptoms of schizophrenia, people who do experience these symptoms, they experience loss of motivation. When you have difficulty wanting to perform your responsibilities or work toward your goals, kind of backtracking, difficulty showing emotion, when you have difficulty expressing how you feel to others, obviously that can really tarnish relationships. Most relationships are built off of intimacy and how well you can express your emotions and difficulty processing information when you find it hard to take action or a conclusion. So you find, easy tasks may be daunting throughout your days, stuff that you typically could take care of, without any issues. So processing information is kind of can be a key hard one for people who suffer. So during the movie, A Beautiful Mind, couple signs and symptoms in the movie. So John really did just experience a strong desire to be important, which led to his delusions. John's mind made up a scenario that he worked for the government as a decoder. His mind told him it was classified information, which made people around him believe his delusions because obviously classified information you can't, you know, talk about with your, people in your life and stuff. So his delusions in his own mind felt right. Um, John's signs and symptoms were hallucinations of Parchal, which was his superior. Parchal was considered the big brother um, of the U.S. government, and Parchal was the boss in his mind, and that was the guy who kind of kept the lock and key on John's mind as the movie kind of progressed. His stress would induce psychosis and would see and hear things that weren't there. So if he had a stressful time or maybe one of his episodes was kind of creeping on and he was starting to feel a little different. His psychosis would take over and he would start to see and hear things that were not there. Um, his hallucinations were so powerful that he did, in fact, live a second life that did not exist. So um, he had his reality life that he was keeping the classified information from the secondary life, and it became hard for him to decipher what was real and what was fake. Yeah. Signs and symptoms continued. Do I believe this was an accurate portrayal of schizophrenia? For me and myself, I do believe this movie did a great job showing this disease. They laid out a perfect image of what people who suffer with this disease go through day to day. It might be a little theatrical at times, but this is actually a very good representation, I think, of what people can kind of suffer and go through. John in the movie experienced hallucinations, which was turned out to be his best friend that did not exist, partial, and his government job. His delusions involved his mind making up his role in life as a decoder for the U.S. government. John's disorganized speech would speak about people who weren't there. His paranoia, stress would induce his paranoia, causing extreme anxiety and distant reality. John's reality was swayed by his delusions, making him believe a world that did not exist. Causes for John's disorder in the movie. So, like I was saying, kind of at the beginning, John was asked by the government to crack a code. Once he cracked it, he experienced an overwhelming feeling of wanting to be important. And that feeling of being important uh, kind of fast tracked his symptoms with the disease. Um, John's anxiety and stress over decoding for the government caused delusions of seeing Big Brother, like I explained, was partial, which started his second life of being a decoder. The stress and anxiety was the cause for his disease to surface. So, types of treatments used in the movie. John was ordered to take a pill form of medication for his disorder. With it being a pill form and with him not having good supervision, John decided to start refusing to take his medication. Um, Once he was refusing, his signs and symptoms obviously became more prominent. And during those prominent times, um, you know, the the delusions took over, and so John eventually got checked into a mental institution where they began, or where he began to receive electroshock 5 times a week. And then they started receiving his pill medication once again when in hospital, when he had no choice but to take his medication. Types of treatment used in today's medicine: lifelong treatment with medicines and psychosocial therapy. Antipsychotic medications are the first line treatment. Psychotherapy can also be helpful. And in very rare cases nowadays, they still do use electroconvulsive therapy, maybe used for adults with schizophrenia who are not responding to medications or who have severe depressions. So those are the extremely rare cases where they still use that. Was the treatment typical with today's medicine? I believe the treatments used in the movie was an accurate representation of treatment because they did start him with a regimen of medications to decrease symptoms. Now, it also is a good depiction in the movie because this is something that true people who suffer with this disease go through. They do eventually refuse to take their medications because they feel in their mind it's hurting them more than helping them. So this was also an accurate representation in the movie when he decided to refuse his medications. When the medication didn't work, or rather when he refused to take them, they began shock therapy 5 times a week to reduce the symptoms as well. These treatments are typical in today's day and age also, which is kind of wild. Impact on John and people around him. So, impact on John, obviously, as you can guess, um, the delusions and hallucinations caused his stress. Uh, Embarrassed in the fact that he is a genius and can't tell the difference from fake and reality, was a huge impact on him because he's used to being a very smart man, and that's, essentially knocked him off his high horse. Hard time accepting that he was losing his mind. I think that would be an impact for anybody going through this disease. Having to deal with that on the front line would be very difficult. Made fun of when trying to reacclimate to society. So when John realized that he did, in fact, have a problem, and that the schizophrenia really was part of his life, he was trying very hard to reacclimate, to a normal life at the college, trying to figure out ways that he could still be a professor and teach. But sometimes his delusions and hallucinations would take over and cause him to have manic episodes in front of the people at the colleges and would cause, make it hard for him to reacclimate to society, like I said. With friends and family, wife trying to accept her husband's illness and the lack of physical touch became stressful. There had been numerous times in the movie where she would try to, maybe initiate some intimate time, and John was unable to or didn't want to because his fictional life was kind of taking over the fact that he needed to be a man in his real life. John's delusions made him leave his child in a bathtub, almost drowning. Uh, so with his best friend, which did not exist, and Parchel, which also did not exist, they found him in his home when he was watching his child and giving him a bath, and his delusions of his best friend and Parchel were trying to pull him away from reality, almost forcing him to forget about his child in the bath that was filling up, almost causing his child to drown until his wife came running into the house after finding his little hideout in the shed where she saw that he was having manic episodes again. Um, so, moving on, John's friend having to find a place for John to fit in. So, all of John's friends that he worked with at the college worked day in and day out trying to find a place that John could fit in and feel normal and feel accepted, and feel, that reality was coming back to him. That's what their ultimate goal was they wanted to try to reprogram his brain, to where he can decipher the real from the fake and hopefully make a life out of it. So those are some huge impacts on the family and friends around him, and of course on John himself. Was this realistically portrayed? This movie did a great job of the portrayal of schizophrenia. It showed the progression perfectly to how someone may experience this illness. His signs and symptoms were very accurate on what someone may experience. The hallucinations over time became more powerful and took over his life because of his stress and anxiety. The progression of his illness started from seeing people who weren't there to building a second reality which he believed existed. This movie did a great job giving a perfect visual of a day in the life with schizophrenia. My overall reaction to this movie and this project. Um, my overall reaction to the movie is it was very informative and depicted the illness of the character perfect. John's progression in the movie showed an image of what someone goes through who has this disease. This disease can affect every aspect of your life in such a negative way. It's very hard. It's very sad to see. Treatments are not guaranteed for people who have schizophrenia, but they did a great portrayal of all symptoms ranging from hallucinations, delusions, and disorganized speech. And here are a few of my site pages that I used for my research involved for this project. I hope that you guys enjoy listening. Hopefully, I had some pretty informative information on there as well. You guys have a great rest of your day. Thanks for watching.